Today we have with us Dr. GURUKIRAN. We all know that he's very familiar with some of the dynamic personalities of this IFPH platform. Dr. GURUKIRAN, BHMS SCPH, have graduated BHMS from Government Homeopathic Medical College, Bangalore. Classical homeopathy practitioner in the district of Chamarajanagar in Karnataka. 15 years of clinical experience and independent researcher. Post-graduation fellowship in SCPH, International Center for Homeopathic Medicine, United Nations. Presented papers in homeopathic approach for the treatment of different types of cases, especially psoriasis, thyroid problems, PCOS, epilepsy, hypertension, respiratory disorders, parahemophilia, GERD, alopecia areata, and infertility. Presented papers in Doordarshan Chandana. The topic is conversion of patient language into rubric part 3. Very, very important session as far as homeopathy profession is concerned, and a lot of areas to be covered in this aspect. So on behalf of IFPH, I welcome Dr. GURUKIRAN. You can have the platform for the next 40 minutes. It's over to you.
Yes, sir. Thank you. Thank you for the welcome, sir. Once again. Good morning and good evening to the participants. Yes, for today's session, it's a continuation of conversion of patient language into rubric, part 3. Today, one change is, in this session, I'll going to present the rubrics with miasms. In the last session, somebody have given me a suggestion that please include miasms. So I have made an attempt to include the miasms for this session with the rubrics. It will be more interesting. Yes, before starting my session, I would like to have blessings from Dr. Samuel Hahnemann, the Master of Homeopathy. This is a very rare pick in which Hahnemann has seen in the cholera epidemic. In the cholera epidemic, this was the situation during the Hahnemann times. Okay. Next, move on to the rubrics now. Today, one more addition is, I would love to present the rubrics with some photographs related to the rubrics. It will be easier to get connected. So the first rubric is, the patient is too timid to look at the blood or knife and may faint looking at it. These kind of personalities we may see in the clinic, also in some of the medical colleges, especially in first year, where they go for an anatomy lab for anatomy dissection. They may faint looking at the cadaver or looking at the blood somewhere. So these type of people we may encounter. This is the miasm psychosyphilis. The rubric is blood or knife cannot look at. This is a rubric for this kind of patients. The main two remedies are alumina and naxomica. So this is the picture. Blood cannot look at, or a knife. The next rubric is, my life seems always dull. I'm not have any interest to work at all. This is also psychosyphilitic rubric. Psychosis is due to loss of interest. Syphilis is due to indifference. That's why it is called as psychosyphilitic, which is called as boredom. My life seems always dull. I'm not having any interest to work at all. This is the picture. Boredom. Bored of. My son used to break all the toys every time. Syphilis. This is one of the kind of expression from the patient side. when the parents say about their children. Sir, yes, sir. My son used to break everything. Whatever you give, any toys, he will break into pieces. You may think of syphilitic miasm in the background. My son used to break all the toys every time. So there is a rubric called as break things desired to. Remember, the patient has to be so much in syphilitic background that he should break everything. Whatever the parents give to him to play, he has to break all the toys. You may consider this rubric, break things desired to. The main remedies are belladonna, apis, nexomica, tarantula, and tuberculinum. In these kind of behaviors, it's called as erratic behaviors. Tuberculinum is an indicated drug. Then think of tuberculinum as an intercurrent, or meanwhile, this is the picture. Break things desired. Excessive happiness is out of control. So miasm is syphilis again. There is an out of control. Whenever there is an strange things, any out of control things, you may think of syphilitic miasm in the background. Buoyancy. The main remedies are coffea, nexomica, fluoric acid, phosphorus, rustox. Excessive happiness is out of control. If somebody behaves in front of you like this with excessive happiness, you may think of this rubric, buoyancy. Yes, next rubric is person very close to me, but he talks some negative statement at my backside. This kind of people definitely we'll see in our families also, in our friends circle, in our also in some of the patients also. If they complain like this, psychosyphilitic, very close to me, but he talks some negative statement at my backside. Calumniate, desire to. Only remedy is ipecac. See, ipecac only we cannot think in only vomiting cases, nausea cases, or in bleeding cases, or in cough. Can also think of in cases like calumniate, desire to, is ipecac. This is the picture. She may be close to him, but he is talking some negative things about her in the backside. Calumniate, desire to. If anybody you encounter this, or if you have some experiences in your family, these kind of persons or personalities, you may think of calumniate, desire to. This has to be very strong. When you have to consider this rubric is, this statement has to be very much strong in the patient, so that you can consider this rubric, calumniate, desire to make grasping movements or gestures. It is syphilis again. Or what is the rubric called as? Corphologia. Corphologia is arnica, arsenicum, hepar, hyoscyamus, iodum, muriatic acid, phosphorus, strontium, and sulfur. This is a picture. Some grasping movements or gestures. They make like this. Something that they will be making like these gestures. Some grasping. You may think of this corphologia. Loss of voluntary movements. Again, it is syphilis. What it is called as? It is called as cataplexia. Catalepsia, sorry. Catalepsia. Catalepsia, there is a rubric in your repertory. Cannabis sativa, coffea, graphitis, lachesis, moschus, opium, and stramonium. This is a picture. Loss of voluntary movements. Person has a habit of finding fault. It is psychosis. Called as censorious critical. He'll be one of the other time, he'll be always making some critics. Fault finding every time. It's called as censorious critical patients or critical censorious patients. Both are same. The remedies are arsenicum, Halilatus leucocephalus. sulfur, and vegetable. Some may complain these kind of things. Sir, he will do some critics every time. Whatever there is, he'll find some fault in it. You can consider this rubric very good rubric, sensorious critical. Person of being strange or unusual in behavior. Again, it's a syphilis. If you feel somebody who is very unusual in his behavior, it may be eccentricity. He may be doing for his attraction, to look over him. Eccentricity is lachesis. You may think of this. See this lady in the picture? So eccentric. It's a very unusual, being strange behavior. Boys look or behave like a typical woman. Again, it's a syphilis. What it is called as effeminate. The he likes to dress like a woman. Likes to wear some female dresses and likes to make earrings and all. You may think of effeminate. Impetuous. Heparsulf, nitric acid, Naxonica, Seria, arsenicum album. You may think of arsenicum album. It's a very good remedy in impetuous. Very urgent, very abrupt. They do something like this. He is very urgent to go down like that. To carry out some action suddenly, throws the chair suddenly when he gets anger. Again, it's a syphilis. There is a very thin line differentiation between these two rubrics that is called as impulsive. This is the picture. Some action suddenly and he throwing the chair by doing this action. It's again a syphilitic miasm. Impulsive. Argentum nitricum, ignitia and pulsatilla. You may listen in the case that my child acts like that in the school. If he gets excited, he will throw the books, he'll throw the bag, he'll throw the pencil box, he'll throw the chair. That is impulsive. Very impulsive in nature. Controversial argument, having heated arguments. This may happen in some of the houses. Always some people raise some disputes. There is a rubric called as disputatious. Disputatious. It's very wonderfully written in the repertory. Disputatious, pharem and lycopodium. Always some heated arguments. They'll be having that nature. When we ask the mind symptoms, if they say this, you may think of disputatious. Disputatious. Person insisting me to follow the opinion, even though she doesn't know whether the ideas are right or wrong. What it is? Psychosis. Dogmatic. The person doesn't know if it is right or wrong. They tell us to follow. They insist, no, you have to do that. If we ask any cross questions, they do not answer. But they would like to follow you. This is dogmatic in nature. Kalicar, argentum nitricum, causticum, sulfur, veratrum album. It's a wonderful rubric. Condition of feeling healthy and comfortable when sick. See, this is a PQRS, exaggerated feeling of well-being. What it is called as. Some may tell that, sir, also I'm sick. I'm very good, sir. I need to go to the office. I am having a lot of work. If you say, no, you have to take rest today in the home because you are sick. No, I am feeling healthy. I have to go to the office. I have to go to the school. What it is, again, this is phyletic background, euphoria. Euphoria, cannabis, cicuta, coffea, crocus, hyoscyamus, lachesis, natramcar, opium. Person having bitter feeling in my inner mind when my mother-in-law keeps on scolding me. Psychosis in nature. Embittered, exasperated is the rubric. Then they will take revenge in some other day. They will develop some bitter feeling when some mother-in-law keeps on scolding. They'll calculate in the mind. They will have some revenge in the further days. Is embittered, exasperated. Hepar and sulfur. Person unable to handle and deal properly in financial matters. Syphilis. Again, especially in financial matters, that is finance inaptitude for. Finance inaptitude for. Silesia and lycopodium. You may think of Beretta, but especially in financial matters, there is a specific rubric. Finance inaptitude for Silesia and lycopodium. Always praises someone for his benefit. What it is? It's a psychotic in nature. Flatterer. It's called as flatterer. You may see in politicians. Flatterer. Always praises someone for his benefit. Lycopodium is the leading remedy. Person who shows disrespect to elders, though teased him many a times. Again, it's a syphilis. Impolite. What we term as impolite. Latina, lachesis, sapia, and sulfur. This is the picture. This happens in the children case. Some of the the parents may complain that whatever times I'll teach him, sir, he will do these kind of things. He will show disrespect to the elders. So it is impolite. When they show disrespect to the teachers in the school, they may complain in parents-teachers meeting. Your child is very mischievous. He shows some disrespect to the teachers in the class. You may think of this rubric, impolite. Hepat, Marxol, Platina, lachesis, sapia, and sulfur. Person who always kicks when he gets anger. Psychosis. This is where we have to be very careful in taking a case while you ask about anger. Definitely we have to ask what is the expression of the anger. If they say, sir, this patient gets angered very easily. Yes, okay, fine. So what will be the expression when the patient gets angered? Some may say, throws the things away. Some may say, he shouts. Some may say, he scolds to everybody. Some people may say, always kicks when he gets angry. He will kick. So this is a psychotic nature. There is a rubric called as kicks. Belladonna, hyoscyamus, and stramonium. This has to be very well marked in the patient history. We have to confirm it. Before repertorizing this rubric, we have to confirm it, considering the rubric that the patient has to be done every time. Whenever he gets anger, he has to do this expression. Kicks. Belladonna, hyoscyamus, and stramonium. Habit of stealing things whenever she goes for shopping, whether it is useful or not. Recently, I think I have remembered some news footage a few years back. Some of the president of some country has steal the pen in front of friends, in front of others. He is a president of one country. Actually, he steals a pen when he is writing something. Syphilis, that is kleptomaniac. It's a habit. He doesn't want to do that. He's a president of the country, but in front of a press, he steals the pen. He's kleptomaniac. This is very, very important. Very good observation, actually, that. Kleptomaniac, belladonna, opium. Person is very jolly and expressive person. Very, very jolly and expressive. This is Sora. This is Sora. Jovial. You can think of rubric jovial. Capsicum, Dioscorea villosa, and Stramonium. Very jolly and expressive. You may think of jovial. When you ask this kind of things in the mind section, sir, if the patient says, sir, he'll be very jovial, sir. He'll be very, always he'll be jolly. Always he'll be like this. So you can think of jovial as a rubric. You can consider in the case. Person used to sleep with lights on during the night. The Sora. Light desire for aconite, belladonna, gelsemium, and stramonium. Stramonium is the leading remedy here. Person used to sleep with lights on during the night. Again, want of light desire for. It's a Soric rubric. So I'd like to cover all the miasms in this. Psychosyphilis, syphilis, Sora, psychosis, all the things. Person who will not leave any issues without taking it to court. What he is called as? Definitely it's a psychotic nature. It's called as litigious. Causticum is the remedy, leading remedy. Litigious. Litigations. Always used to take into litigations. Litigious. Whatever issue, they will take it to the court. They will say that I'll send you a law notice. I'll send you a law notice tomorrow. Yes, you may think of litigious. Person who is not serious even at important matters. Again, it's a psychosyphilitic nature. Ludicrous. Very important matter, but he is not serious at all. Alzheimer's, nuts moscata. 2 remedies. When you are talking about any financial things or any construction matters or any health matter, when the patient is not at all serious. Ludicrous. It's a very good rubric. When my mother-in-law scolds me, we'll wait for the right time to scold her back. What it is? Again, it's a syphilitic miasm. Malicious, spiteful, vindictive. Anacardium, lachesis, chamomilla, hepar, natrum. When the both mother-in-law and daughter-in-law comes together, then you can see these kind of things. The mother-in-law says, so if I scold her, some of the other time she'll wait and in the right time she will scold me back again, sir. Yes, that is malicious, spiteful, vindictive. Anacardium, lachesis, chamomilla, hepar, natrum. Patients, especially patients who have a habit to cheat or mislead to get an advantage. They may manipulate a doctor by hiding some information or giving the false facts. We should be very careful in the clinics when we encounter these kind of patients. It's a psychotic nature, psychosis miasm. They are called as manipulative. They will showcase something, but it will be not there in the case. They will cheat, they will mislead us to take an advantage. Or they may say, like this is, if the clinic is busy, they'll come in the waiting room. They'll say, sir, emergency, sir. Abdomen is paining, emergency, sir. When you look into it, no emergency at all. For their time's sake, they'll do these kind of things. They're mislead. They take advantage. You can think of manipulative. Arsenicum, lachesis, pulsatilla, and sulfur. Patients who have ability to solve problems and calculations. Mathematics, calculating, inept for. Inability to solve the problems in calculation, especially mathematics. There is a specific rubric. This kind of things we can encounter in children. Mathematics, calculating, inept for. Elianthus and Nexomica. Private devotion or spiritual exercise consisting in deep continued reflection on religious theme. Now this has become very common, I think. Whatever you say, sir, I'll do meditation, sir. I'm doing meditation, sir. If you ask, are you really doing meditations? It's very hard. Actual meditation is doing very, very hard. A series of thoughts by any subject. This is called as meditation. There is a specific rubric in the repertory. Meditation. Carbonimalis and sepia. Like this. A hatred of mankind or distrust of human beings. It's again syphilitic background. A hatredness towards the mankind. Misanthropy. It's called as misanthropy. Natrum carbon anacadium. See, this picture is very wonderful. No humans alone. Hatred of mankind. They do not trust any kind of, because that is the kind of pain they have experienced. They will not trust any human beings. You can think of misanthropy. Natrum carbon anacadium. Person who is excessively concerned with minor details, like bookworm, methodologist. Again, it's a syphilis. Wonderful rubric called as pedant. Excessively concerned with the minor details. If the patients in your clinic, they sit in front of you, they'll be looking at some minor details, like your handwriting, your letters, or in the table in front of you, or in the laptops. Recently, I have experienced some patient in my clinic. He said, sir, your laptop, in your laptop, there is a crack. I thought, where? It's a new laptop, where it is. He showed me there is a very thin hairline crack in my laptop. He showed me. Sir, there is a very thin hairline. So in that cases, you can think of pedant. Excessively concerned with minor details. Or bookworms. Also, you can think of pedant. I don't feel any emotions during stressful situations. Again, it's a disposition free from stress or emotions. Syphilitic. Placidity. Opium, phosphoric acid, and sepia. Any kind of emotion during any stressful situations. Placidity. They'll be placid in nature. Opium, phosphoric acid, and sepia. 3 main remedies. Wonderful rubric in the repertory. Some daughter-in-laws may be seeing this. Patients who hate their mother-in-law. Can we ever think of these kind of rubrics in our homeopathic repertory? Yes, it is. Patients who hate their mother-in-law. They can't see the face of mother-in-law. Syphilitic. Hatred mother-in-law. Scorpion. Scorpion is a leading drug. If anybody wants to have this scorpion, you can order it. Who hates their mother-in-law. They can't see the face of mother-in-law. Scorpion. What we can expect after giving scorpion? That will be a very good discussion after time. Power of foretelling in future. Syphilis. It's called as prophesying. Power of foretelling the future. That is aconite, lachesis, argentum nitricum, coffee, and agaricus. It's prophesying. Person who had inability to read This is common in children cases. Sir, my son is very unable to read some books or some subjects. There is a specific rubric, reading unable to. Ethusa, Natramio, Baratakar, and Sepia. He is unable to read. Feels very badly about that particular incident happened few years ago. What it is? It's a syphilitic background again. Remorse. This is very common, I think, when we take some cases. Sir, I feel very bad about the particular incident that happened 4 years back, few years back. He says, if it is very strong in the patient, if this thing, you can think of rubric remorse. You may think of aurum, coffea, sulfur, and veratrum album. He feels very bad about that, especially the particular incidents. They may say it in front of you. This was the thing, it has happened, and I feel very bad to that. Yes, you can think of remorse. It's a wonderful rubric in guiding symptoms. And child is answering even before the teacher complete the questions. Very hyperactive child. It's very soric in background. Agility mental. Very good rubric. You can see in the these kind of things in quiz competitions. He answers before the teacher complete the questions. You may think of agility mental. Coffea, opium. Very, very sharp child. A caring, friendly attitude, even towards enemies. What it is? A Sora in the background. Affability, enemy too. Alcoholus. Alcoholus is a wonderful drug. A caring, friendly attitude, even towards enemies. Affability, enemy to alcoholus. Children having slower mental development than the normal. Syphilis. Retarded children. Baratakar, carcinosin, ethusa. You can see the picture of a retarded child. There is a specific rubric in the repertoire is retarded children. Persons likes to enjoy going to party without taking care of exams. Again, psychosis. Very, very psychosis. Tomorrow there is an exam. This boy goes for a party. Revelry, feasting. Nakshamika, Natrankar, Madorainam. Revelry. It's a wonderful rubric. Like this. Goes for a party. Tomorrow there is an exam. These kind of encounter when you in your clinics, they may say that the mother may say these kind of symptoms. So this boy, the day before yesterday the exam, went to the party. He came very late. He did not study anything, but still he attended the exam. Revelry, feasting. To speak bitterly, ridicule, psychosismasm. What is called as sarcasm. They'll say in front of others without any thought. Sarcasm. Arsenicum, belladonna, carbohydrate, china, graphitis, ignitia platinum. Graphitis works very well. I have given it in one of the cases to crack a PCOD case. The patient's nature was sarcasm. She was very sarcastic. Her mother always used to say that. She will ridicule always in the home. She used to speak bitterly in front of others. Without thinking anything, without thinking twice. She'll speak bitterly in front of any guest or in front of parents also. So I use the rubric there, sarcasm. Graphitis. Graphitis is a leading drug then. Graphitis cleared the PCOS case. Person feels giddiness after being or degraded by mother. Is again syphilis. Scorn ailments from. This is a picture. Scorn ailments from. Desire for gardening and planting. What it is? Sora. Plant loves for is Adonis Vernalis. Always they'll make that work only. Plants loves for Adonis Vernalis. Humorous with full of high spirit. Again, Sora. He'll be always humorous, high spirit in nature, playful. Cicuta stramonium. Like this. Full of high spirit, will be humorous. This is a Soric nature. Commonly we see in this in children. Women always thinking about same unpleasant event. What it is? Syphilis again, the background. Thought persistent, unpleasant. Thoughts haunted by. There is a rubric. Thought which is persistent, which is unpleasant also. That thoughts will be haunting. Natramure, Ambragresia, Barrettacar, Cocculus. See, this is the picture. Same the unpleasant thing, what has happened in the past. She will be always thinking that. Some may say this in the clinic. Yes, sir. Sir, I used to get some unpleasant thoughts only, sir. Some negative thoughts. It will be always persistent. You can think of this rubric. Again, trigeminal neuralgia. You can see in this herpes cases, psychosyphilis. Face, there is specific rubric. Face, trigeminal neuralgia. Magnesium, phos, spigelia, belladonna, calmia, plumbum, rustox. Also, you can think of ranunculus bulbosa. Trigeminal neuralgia. My son doesn't like to read. Psychosis. I have shown the difference there. Unable to read is a different thing. Unable to read is a different thing. There is a specific rubric. This is doesn't like to read. He knows how to read, what to read. But there is an aversion. Reading aversion for. My son doesn't like to read, or he always wants to play outside. Always wants to play some video games. Always wants to play in the mobile. You can think of this rubric. So it's a psychotic nature. Next one, phosphorus, rustox. Whenever there is a problem with someone, I do not blame others. I feel all the problems because of me only. What it is? This kind of patients, some of the doctors have encountered. Again, it's a syphilis. Reproaches himself. Always they say, only because of me this has happened. Always with my behavior, always with my act, this has happened. Wherever there is a problem with someone, this is reproaches himself. Anacardium, aurum, ignitia, staphysagria. Mental disorder involving breakdown in relation between thought, emotions, and behavior. Inappropriate actions and feelings. What it is called as, against a syphilitic background, schizophrenia. It's a direct rubric, the repertory. You can think of anacardium, belladonna, hyoscyamus, lachesis, and nux vomica. Inhaling of larger quantity of air than usual and sudden emission of long, deep audible breath, which occurs during grief, weakness, relief, what it is called as sighing. Person who tried to commit suicide, I think of committing suicide as I did earlier. So again, syphilis, suicidal disposition for aurum, ars, belladonna, hepar, hyoscyamus, myrrh, and natrum sulph. So this is the picture. Again, another differentiation of this rubric is any setbacks in my path, I feel committing suicide, but I have never attempted it. what it is. It's a suicidal disposition, thoughts. Alumina, aurum, natrum self, and sorinum. I feel committing suicide, but I have never attempted it. Here, there is an attempt. Person who tried to commit suicide like this. He may go into the heights. They may cross the barriers, as I did earlier. That is suicidal disposition. But in this suicidal disposition, thoughts, only thoughts, will not attempt it. There are two different rubrics. There is a differentiation between it. Alumina, aurum, natrum self, and sorinum. When I visit temple, I go to trance during bell ringing sounds. You may see this kind of persons in some temples. Syphilis, trance, they go to the trance. Anhelinum, lachesis, opium. Persons behaving rude in front of others or elders, not answering questions, whatever they ask, that is syphilis. Undignified, that is alcoholus, hyoscyamus, sorinum, and sulfur. They behave very rudely. Also, in front of elders also, not answering questions, whatever they ask. They may sit with crossed legs, or they may answer very rudely. Can think of undignified, or they may dance like this in front of some elders or in a very serious situations. Undignified manner. Alcoholus, hyoscyamus, sorinum, sulfur. Person who is morally bad and having wrong principle and practice, again psychosyphilitic in nature. Wicked disposition. Anacardium, cocculus, nexomica, and tuja. Like this. Person who is attractive, energetic, and enthusiastic, and animated in temper. Again, it's a psychotic. Vivaciousness. Very, you can see in some of the girls. Very attractive. So she'll be very energetic and also enthusiastic, but animated. And it gets temper.
Excuse me, Dr. Gurukiran.
Sir.
I think we can stop here with a positive attitude, the vivaciousness.
Yes, sir. Yes, sir.
Time to we can continue another day.
I think one more slide remaining, I think, sir.
Yes, yes.
Yes, sir. Last slide that was.
Yes, that's good. Vivaciousness is very important. So time for discussion, an absolutely wonderful presentation. I think one of the important for the last 1033 days. Very important, very interesting. And this is the nucleus or the core of homeopathy practice in selection of the remedy. Time for discussion. Those who would like to participate can go to the participant list and raise your hand. Dr. Veena, Ganesh, raise the hand. Dr. Veena, please. Yes.
Good evening, Doctor. So thank you for taking this class on my request. I'm really well obliged. Thank you, sir.
Thank you, madam.
And really, it's very informative. And if you can circulate the PDFs, it's very helpful for our reference.
Madam, the voice is breaking. I'm not able to hear you.
No, if you can circulate the PDF, it may be helpful for us to refer. Yeah.
Yes, yes,
so
yes, definitely.
This is the third class. So we would request for a class PDF put together so that we can have a soft copy of whatever you have taught. Then one more thing is, you have added the rubrics with miasms. You have added the medicines. So mostly from which repertory, sir?
Almost complete and Murphy. Complete repertory and Murphy repertory. Some of them make from Kent.
Because some rubrics, as you said, like the patient, though sick, but never admits that he is sick and will not take medicine.
Yes.
The main medicine is told as arnica in keynotes.
Yes.
but it is not there in the in your slide.
Yes,
Likewise,
definitely.
malicious,
Yes.
revengeful, malicious. Nitric
Yes.
acid is the main medicine, but it is not found.
Yes. See,
Suicidal.
what I have done is in the complete repertory, Murphy repertory, only the leading remedies, where the marks is very much high, only those remedies have mentioned it. Arnica may be mentioned in one single mark or only 2 marks. That I have not taken. Only 4 mark and 3 mark remedies are mentioned here. If it is there, it's okay, fine, no problem.
Okay.
Yeah.
My question, my doubt was that, doctor, because it's
Yeah,
not
fine,
mentioned.
fine.
But
Yes,
in keynote,
that's also good. Always.
that
Yes.
is why. Okay. Thank you,
Yes.
doctor. Thanks for the explanation also. Thank you so
Thank you.
much.
Thank you.
Yes. Now, Ahmad Hassan sir. Sir, please, you can unmute now. Ahmad Hassan sir. Yeah.
Good evening to all. Dr. GURUKIRAN sir, very thank you for your this wonderful webinar. You mentioned about boy innovating like girls, but in my family there is one girl about 3 years old. She always tells that I am boy, and she always like to wear, but she's only 3 years old, but she don't like anything. So can you tell me something about
Mannish. Mannish is a rubric. Mannish. In the
okay.
females, if they show some boy-like behavior, there's a rubric called as mannish.
Okay, yeah. But any remedies, if you can?
I have to see the case completely. Then I can consider it. Yeah.
Thank you very much. Thank
Yes,
you very
yes.
much.
Okay.
Very nice presentation and very educative in all sphere. Thank you very much.
Thank you.
Yes. Now, Dr. Salim Kumar. Please unmute Dr. Salim Kumar. Yes.
Sir,
Yes.
very nice class. I'm very much influenced by you. Till
Thank you.
today, I thought that the remorse and the guilt feeling, these rubrics are same. Can you explain it?
Which one's remorse and?
Remorse and guilt.
Yeah, that's what, sir. I have shown the photograph also. Remorse is always they'll be having some unpleasant thing. They'll be thinking of the same thing again and again. Guilt feeling is if there is any incident happen, they have done something wrong. Only that they feel some guilt about that incident, particular thing, what they had happened or what they had experienced it. That is guilt. Remorse is which is broader, in a broader sense.
Okay, you corrected me. Okay, I thought it's okay, sir. Thank you. It's very good. Sir, why can't you make a book or it is a compilation? It is very worth it.
It's already there is a lot of books regarding this. I have taken some of the parts and my knowledge with that, with the some cases background, I have presented it. That's all.
But this is very. It will be a key to the rubric. I think
yes,
this
sir.
is very good.
Yes, sir. Okay.
Make it a book.
You can expect more than from Dr. GURUKIRAN in the coming days. Definitely.
Okay.
Yes. Now another person. Definitely this time he's more happy. Maybe jovial this time. Dr. Hariharan sir. Yes. Sir, please unmute. Hariharan sir.
Okay. Dr. GURUKIRAN, good evening.
Yes, sir. Yes,
Good
sir.
evening.
Good evening, sir.
See, this is what we expected from you. You have done wonderful work. But I like to say, one doctor said malicious.
Yes.
In Kender repertory, stramonium and naxomica given more mark.
Okay.
Kender repertory.
Okay.
Kender repertory. See, Dr. Salim Kumar asked, see, for remorse. See, that meaning is in Malayalam, Pachatapa.
Correct. In Kannada also we say Pashatapa.
Pachatapa.
Yes.
A committed, already committed a wrong thing. And
yes.
That is Pachatapa.
Yes, correct. It will be in a broader sense. Guilt will be in a very smaller sense.
Okay.
Only that particular incident, only the guilt, that's all.
That's all.
But remorse is very deep.
See, there are very slight difference, like envy and anger.
Yes, yes, correct.
Very difficult to differentiate
Correct.
what
correct.
is enemy and what is I. Okay, Gurukiran, you have done a wonderful work. One day you will become a famous homeopath all over India. No doubt in that. Thank you very much.
Yes. Okay, sir. Now, Dr. Rajan, sir, please unmute.
Yes.
Yes, sir. Please proceed.
Hello, doctor.
Yes,
Thank
sir.
you for your nice presentation.
Thank
You
you.
described about reading aversion, phosphorus, and next. What about? I want to know medicine. Most who not interested in writing. Not
Not
interested in
interested in
writing.
writing. Okay.
Yes.
I think
What
it
is-
may, we can think of difficulty in writing. There may be separate. I think in the second session class, I have presented that. Difficulty in writing.
Yes.
There is a rubric.
Not interested in writing.
Not interested in writing.
Yes, yes, yes.
Then you can think of aversion to writing. There may be a
Yes.
rubric. Yeah.
Okay.
Okay, thank you.
Yes, yes.
Now, Dr. Abraham Vaidyan. Doctor, please unmute. Dr. Abraham
Hello.
Vaidyan. Yes, please.
Hello, Dr. Gurukiran. Thank you for your valuable class.
Yes, sir.
I think you're having a very good knowledge in rubrics, etc. But for the point of practicing, you clarify differentiate the miasm, etc. Very good. But you said that you said some medicines for particular complaints. I think it gives a wrong direction, because after getting a few symptoms, we convert as a rubric, and after tailoring the rubrics, we make the totality of the case.
Yes, definitely.
And by finding the totality of the case, we got some idea of the drugs.
Yes.
After that only we can select the medicine.
Correct. Definitely.
That's the exact medicine. But if you from each symptom you suggest some medicine, it may misguide the new doctors.
Yes, yes. Because I have firstly I said itself, you have to make a totality. You may think of these remedies. That's what I mean to say. Not exactly the same remedies. You may get into this. When you make a totality, one of the remedies, it may be nexomica, it may be sulfur, it may be heparin, it may be lycosis, it may be lycosis. You may fit into it. That's why I need to stress every time that this has to be there in a deeper manner. This symptom has to be there when you consider to it into the case totality. After making a totality also, we have to prescribe. Until then, only basis of these kind of rubrics, we can't prescribe at all. We have to make a totality. It's very clear.
If thinking like that, the physician must become an prejudice to certain medicines.
No.
Prejudice to certain medicines may
You
harm
should be an unprejudiced observer. As
harm
Hemant
the
says.
Yes.
Okay. Anyway, thank you, Gurukiran, for your
Yes, yes.
valuable
Thank you.
class.
Thank you.
Well, all these opinions also reveal certain medicines. Definitely, that is a very interesting thing. Now, Dr. Nudan Sharma, yes, please. Yes, Dr. Nudan.
Yeah. Good evening, everyone.
Yes.
Dr. Guru, it was nice presentation. Wonderful. Very informative. The only thing is my half of the question covered by Mr. Abraham just now, because you make audience prejudice. One thing. Secondly, are the most commonest repertories, a complete and Kent, should be used in my opinion, because you are missing most common medicines like misanthropy, Merck is not there. Then reapproaches, Natrum is not there. So like that, we are missing common medicines, So looking forward to see more chapters other than 9 in future classes. It was wonderful. Thank you so much.
Thank you.
Thanks, Dr. Manoj.
Thank you. Thank you.
Yes, okay, thank you. Now, this Parisa. Sir, please unmute. Yes,
Hello. Doctor, Guru, congratulations,
sir.
a big
Thank you, sir.
congrats. Deepest appreciation for your wonderful presentation on a very relevant and modern topic. You said that you have made it in a professional way. Adding the picture made the things all the more clear and simple. I am not a homeopath, just a homeo lover. I could also grasp what you were trying to say. You should definitely come again with a humble request and make similar presentations so that the entire body, entire platform will enrich by your presentations. Thank you very much. All the best. Thank you.
Thank you. Thank you, sir.
Yes. Regarding the rubrics you made, there's also a lot of social importance also, because this kleptomania is a really pathetic for a nation to have for a president or prime minister who is having this habit. Then the families, it has got very much importance. So that it's only, I think, through homeopathy we can have a solution for that. Now, Geeta, madam, wait. Yes, madam, please unmute. Yes, Geeta,
Okay,
madam.
Dr. Gurukiran, very nice presentation.
Thank you,
Let me
ma'am.
ask something. What is the difference between this irritability and anger? How we can elicit a patient, irritability in a patient or anger in a patient? What is the actual difference?
Madam,
Almost the
irritability.
same medicines are listed under the
Yes.
both rubrics.
Yes. Irritability is just an soric thing.
Okay.
It's just an soric thing. It's a superficial thing. Anger, it may be psychosyphilitic. You
Okay,
can
so,
think that. Yes.
so I think irritability is a subjective feeling and anger is expression. Is it correct? Irritability is a subjective feeling.
Yes.
And
Yes.
anger is its expression.
Yes, definitely. It's an expression, but it will be more syphilitic in nature if they do some harm after getting anger. You may think of that.
In the same way, we can explain hurry and impatience also.
Yes.
Impatience is subjective and hurry is its expression.
Definitely. Yes, ma'am.
Yes. Okay. So definitely we need a Shakespearean mind to go through the homeopathic, the soul of homeopathy. There is no doubt about that. That is why the highly intelligent persons like Rabindranath Tagore and Mahatma, Dr. Radhakrishnan and Alfred Einstein, all these fellows recognize the homeopathy, and those don't have that much talent fail to recognize homeopathy. So everybody must enrich their brain. They have to add and add, think and think again and again. Just like our Hidra Kumsar, he's still working very hard and reading, thinking, just like that is why we can see a lot of quotations in the genius of homeopathy or by Stuart Close, then Dudgeon, quoting from Shakespeare, homeopathy prior to Hahnemann, where he quoting Shakespeare, just the finding of circulation. You are my true and honorable wife, as dear to me as are the ruddy drops that visit my sad heart. You know, the circulation, the technically it was found out later, but it was written by Shakespeare. It's coming and going. It's visiting my sad heart. Visitor coming and going. So that type of readings, intellectual work is very much there. So to become an honest homeopathist is not at all an easy affair. To express word of thanks, I am inviting Parisa. Yes, sir, please.
Hello. I had nothing to add because my vocabulary is not very apt to appreciate this presentation. Anyhow, may I express attitude of gratitude to you, Dr. Kadir. You will have a very bright future in this field, and also you can add your talents to other fields also, as our Manoj has just implied in that. All the best. Thank you very much. Thank you. All the best.
Thank you, sir. Thank you.